Human papillomavirus is the commonest sexually transmitted infection of the reproductive tract. Though sexually transmitted, you do not need to have penetrative sex to have it. You can get HPV from any skin-to-skin contact of the genital area. Most people with the virus usually clears it within 2 years. But, in some cases, the virus persists and causes genital warts and cancers. HPV is of great concern in women because HPV infection is responsible for more than 90% of cervical cancers. Unfortunately, most people who are infected are not aware of it and spread it to susceptible persons. The good thing is that HPV infections can be prevented through the use of HPV vaccine. But how is HPV vaccine administered? It is recommended that the vaccine be given starting from age 9 years to on or before the 14th birthday. This is usually before the individual becomes sexually active and gets exposed to the virus. If given at this period, 2 shots, given at 6 months apart, are enough to protect the receiver of the vaccine. For those who do not get the vaccine during the period, then a 3-dose regime is recommended, given at 0, 2, and 6 months. It is important you speak with your health care provider to determine if you are qualified to take the vaccine. So, what are the benefits of the HPV vaccine? Why is it important that you get the vaccine if you are eligible? First, it protects against HPV infections. This way, it helps to prevent more than 90% of cancers that are linked to HPV infections. Also, it leads to a reduction in HPV infections. Since HPV vaccination was first recommended in 2006, infections with HPV types that cause most HPV cancers and genital warts have dropped significantly. Infections have dropped 88% among teen girls and 81% among young adult women. Besides, when combined with cervical screening, HPV vaccine is the greatest weapon against cervical cancer. Finally, HPV vaccination helps to save money. Money that otherwise would have been spent on hospital bills and cancer treatment can be better utilized. Scientific evidence supports this fact. There is no cure for human papillomavirus infections. But you can protect yourself and others by getting the needed vaccine at the recommended schedule. It is a great investment to protect the future